Hi, everyone. I'm Anna Maria Tirano, the Vice President of Marketing at Cinzy. Welcome to today's Learning Lab presentation, hosted by Cinzy and featuring Stratus Video. The content covered today will highlight why and how your organization can use telehealth to engage patients who prefer to communicate in a language other than English. Our panelists today include Parker, Marketing Specialist at Stratus Video, Mike, a Director of Solutions Engineering at Cinzy, Elena, she's joining us as a Language Operations Manager from Stratus, and she's also a certified and highly experienced Spanish interpreter at Stratus Video. And they are joined by Rebecca, an ASL interpreter with Stratus Video. And you are seeing that in our Spotlight video, Rebecca is interpreting along with our presentation today. Today's presentation is being recorded, and the recording will be sent to all attendees and registrants later this week. All participants are muted. If you have a question, please use the Q&A tool in this webinar platform at any time. We will respond to the questions at the end of the webinar.
Thank you, Anna Maria. Good afternoon, everyone, and good morning. Thank you for joining us today. I'm going to kick it off with an overview of Stratus Video. We are an AMN healthcare company that provides language services for healthcare providers to better communicate with their limited English proficient, or LEP, deaf and hard of hearing patients. We are the largest and fastest growing video remote interpreting company in the world, with over 1,900 hospitals and thousands of clinics currently using our solutions. Our language services include video remote interpretation, or VRI, which provides direct access to a qualified medical interpreter over encrypted HIPAA-compliant video. We currently offer this in 40 languages, including American Sign Language and certified deaf interpreters. Our over-the-phone interpretation service provides access to interpreters in more than 200 languages. Having such a wide range of interpreters helps ensure language access is available to patients even when there are requests for languages that are not frequently encountered. Our on-site interpretation service provides complete visibility into interpreter scheduling and management. Providers can request local interpreters to come on site and even track their progress as they make their way to the location. We also offer translation services for any needed document requests. A quick note of clarification here: there is a difference between interpretation and translation. Interpretation refers to the oral word signed or spoken, while translation refers to written communications. And lastly, our language interpretation for telehealth solution allows healthcare staff to be able to add a qualified medical interpreter to virtual consults. And with that, I will pass the ball over to Michael.
Thank you, Parker. Good morning, good afternoon, everyone. So Cinzy, we are a virtual care company based in St. Petersburg, Florida, solely focused on healthcare, and a bulk of our client base is in post-acute care. So really about the Cinzy platform, we are an all-in-one comprehensive communications platform that allows clinicians and patients to communicate the same way they would in their everyday lives. The platform enables clinicians to communicate with colleagues securely via virtual visit and secure messaging on any device. And in addition to that, Cinzy allows for bidirectional communication with patients in a variety of modalities, and we'll dig into those a little bit more. The clinician also has the ability to engage any caregivers or family members associated to the patient, and that is with automated programs or other communication methods. One of our big differentiators for us, aside from other telehealth or virtual care platforms, is that we are able to bring in a live video interpreter into a video visit, or have a pre-translated text and email templates generated in patient communications. And then really lastly, administrators have the ability to view all this data in real time and all the activity within the platform. So next slide, please. Okay, so just a little bit more about our offerings and our platform. As I mentioned earlier, the clinician and the patient are able to conduct a virtual visit, as you can see by the video visit up top, secure message, which is a PHI instant message chat, text, email, automated programs, and these can be based on specific conditions, so managing patients with chronic conditions, assessments, and remote patient monitoring on the same platform. These are really all the different communication modalities are a way to gather more data in between in-home visits. A little bit about our newer offering, remote patient monitoring, is really the fastest and easiest remote patient monitoring solution to implement. With Cinzy, your patients can easily share their vital signs from a smartphone or tablet with Bluetooth enabled and consumer products. Your staff can monitor weight, temperature, blood pressure, blood oxygen levels, heart rate, and glucose. And our dashboard highlights real-time patient data and triggers alerts when a patient's data is out of a normal range, so your team can quickly intervene. And then your referral partners can also continue tracking health data for a patient who has been released to one's home or nursing facility.
Thanks, Michael. So what is meaningful access? In healthcare, in order for patients to have meaningful access to their healthcare information and adhere to healthcare plans, they must be able to receive that information in a way they can understand. The Joint Commission further explains, effective communication allows patients to participate more fully in their care. When a patient understands what is being said about his or her care, treatment, and services, that patient is more likely to fulfill critical healthcare responsibilities. For LEP patients, effective communication requires the use of medically qualified language services, which include over the phone, video remote, and on-site interpreters, as well as translation of vital documents. And vital documents are either required by law or contain critical information for obtaining federal services or benefits. Now, moving to the next slide, speaking of requirements, several regulations have been put in place to help ensure LEP deaf and hard of hearing patients are provided meaningful access to pertinent information surrounding their healthcare and well-being. These laws include Title VI of the Civil Rights Act of 1964, National Standards on Culturally and Linguistically Appropriate Services, Americans with Disabilities Act, the Hill-Burton Act, and most recently, Section 1557 of the Affordable Care Act. Section 1557 requires healthcare organizations receiving federal funding to provide meaningful access, there's that word again, to each LEP individual to be served or likely to be encountered in its health programs and activities. Also requires healthcare providers to publish taglines, which are short statements in the non-English languages, and to post them in prominent locations. And these statements notify individuals about the availability of language assistance and services, basically saying that the services are there for them to use. And this is an example of a vital document that would have to be translated. Section 1557 also requires providers to offer a qualified interpreter when oral interpretation is considered a reasonable step to be able to have meaningful access, and to provide these services free of charge, also in a timely manner. And, you know, we may wonder, why are these regulations put into effect? Moving to the next slide, we can demonstrate it is because studies show time and time again, effective communication is essential to positive health outcomes. In addition, research demonstrates that due to language barriers, LEP patients experience poorer quality of care and outcome. They have less access to preventive services and are less likely to adhere to healthcare plans than their English-speaking counterparts. Here are a few examples. LEP patients have a higher tendency of comorbidities, including mental illness, respiratory disease, cardiovascular disease, and diabetes. Adverse events are more common among LEP patients, and these events are more likely due to communication error. Hospital stays, interestingly, are longer for patients with limited English proficiency that are not provided with a qualified interpreter. And this really demonstrates, again, the incredible impact that communication has on health outcome. So moving on to the next slide, there's another interesting study. This was a pilot study of 6 U.S. Joint Commission accredited hospitals, all of which analyzed language proficiency and adverse events in LEP patients. And that study found, in addition to the LEP patients experiencing an adverse event and being more likely to be harmed, the event was more often from communication error, and the harm was more likely to be serious. The study concluded that providers can better prepare for encounters with deaf and LEP patients by 1, identifying the top languages needed, 2, collecting language data at the point of entry for any new or walk-in patients, and 3, documenting the language services provided for each session. So with a combination of on-site, video remote, over the phone, and translation services, by having these different modes of language services at the provider's fingertips, healthcare staff can ensure effective communication, essentially in any language. The key is to identify the language needs of the patient population and to also establish when to use each mode of interpretation for optimal coverage and efficiency. And that brings us to the next slide. Who are the LEP patients? And what are the top languages needed? With a solid grasp of the LEP patient population, providers can better plan to ensure qualified medical interpreters are available when and where they are needed. Now, the limited English proficient population in the US is quite large. There are currently more than 25 million LEP individuals in the United States. These are individuals who do not speak English as their primary language and who have a limited ability to read, speak, write, or understand English. At least 350 languages are spoken in US homes. Nearly 9% of people in the United States are considered LEP. 1 million LEP home health patients today need language access. Roughly 11 million people in the United States are deaf or hard of hearing. And a higher percentage of LEP patients report having low health literacy than English-speaking patients. Low health literacy alone impacts the patient's ability to understand instructions and navigate complex healthcare systems. And when there's a language barrier present, that risk multiplies. So moving on to the next slide, that last one kind of gave a large view of the United States, but honing into where you may be located, providers can find the top 15 languages in their state on the U.S. Department of Health and Human Services Office for Civil Rights resource page. There they provide both population estimates, and as well as there's several translations there that are provided for providers to be able to use, which is helpful because population, or I'm sorry, part of the Section 1557 tagline requirement is to post those statements that language services are available. So that's there as well. And another helpful resource is the U.S. Census Bureau data. They recently did a great study and community survey results that show the top languages in the 15 largest metro areas of the United States. So if you happen to be located in one of the 15 largest metro areas, there's a lot of great data there as well. It includes New York, Los Angeles, Washington, D.C., Seattle, Phoenix, San Francisco, Dallas, Chicago, Atlanta, Philadelphia, Houston, Riverside, California, Boston, Miami, and Detroit. So if you happen to be located in one of those places, there's some great data there. Moving on to the next slide, we have an example of that. The key findings include the number of languages spoken other than English at home for that particular metro area, the percentage of the population aged 5 and over, and also data on smaller language groups. This particular example is the New York metro area. So you can see it's quite impressive. There's 192 languages spoken at home other than English just in this one area. 38% of the metro area population age speaks the language other than English at home. And one of the smaller language groups is Bengali. And knowing this kind of information can really help plan to make sure the appropriate resources are available for the LEP patient population. And with that, I will pass it back over to Michael.
Thank you again. So what I want to take a look at next is how telehealth benefits the LEP patient and using real life client examples. So what you're looking at on the screen is just some key metrics on how virtual care and telehealth, helps in general across the entire patient population plus the LEP population. But some of the general benefits of virtual care and then how it ties into LEP patients is that we always say that we never intended our platform to replace all in-person visits, but wanted to certainly augment care, be just as good as an in-person visit, and really increasing the amount of touches to that patient with very minimal lift, excuse me. And especially in the days of COVID, some areas across the country, you might want to be reducing those in-person visits, but still retain that same amount of contact. Virtual care gives you that ability. So really some feedback and data we have received from our clients over the past several years have been things like being able to see more patients in their schedule, reducing very long drive times. Obviously depending upon where you are in the country, there might be a shortage of a specific specialty that might not be able to get to all places within a county or within the state in one day. So really being able to see more patients throughout the day. Another major story that we always hear from a lot of our clients is it could be Sunday night at 10 o'clock and being able to assess the patient with one click of a button to get eyes on your patient, has been a huge value. And being able to bring in a live video interpreter if a specific nurse on call, is not able to speak that patient specific language has been a huge value. And we really found through all the data that this has drastically reduced ER visits and rehospitalizations. And then really the other key takeaway on the administrator side is being able to just track patient engagement and staff utilization, as well as just gaining more transparency into the field. So one of the major aspects of tracking patient engagement is making sure those LEP patients are receiving communications in their native language, they're opening emails, they're reading things like medication reminders or maybe reminders to get more exercise or reduce their sodium intake has been very valuable. Next slide, please. Okay, so some more real life examples, and we just call them just use case of examples of how our clients are using the platform. There are many communication modalities within our system. One of our goals with new clients is to understand a primary and secondary problem they are looking to solve immediately. So the platform is entirely configurable based upon roles within your organization. Two of our most common use cases across the country are reducing readmissions for patients with chronic conditions, and those can be LEP patients or just the general population, and wound care. Using our automated messages via text and email, as well as assessments, virtual visits, remote patient monitoring, we've seen our clients successfully reduce hospital readmissions and provide better care. We have seen tremendous results in data in targeting non-English speaking patients with chronic conditions in those automated program communications in their native language. So for instance, if you're targeting COPD patients or CHF patients that are LEP patients, being able to provide that education in their native language has been of huge value. So really where this leads us is for patients with limited English proficiency, linguistic and cultural barriers can result in misunderstandings regarding diagnosis, treatment, self-care, some of those care plans that most patients are just receiving in English. Medication instructions and follow-up care plans might not be fully understood, and that results in non-compliance. So there may be a hesitancy from the patient to really ask questions for clarification or request assistance with emerging conditions, resulting in rehospitalization and more exacerbation of chronic conditions. And these scenarios all lead to lower patient satisfaction and worse outcomes for LEP patients. All right, so to really sum up what you're looking at on this screen, on this graph, the study results on here are the impact of interpretation on patient adherence. So patients had more prescriptions written, filled more prescriptions, attended more preventative exams, and utilized more clinical services when they were provided with services of a qualified interpreter than those who were not. Okay, so next slide, please. So what I just want to show you coming forward in the next two slides, but just a minute on this one slide, is how interpretation and message translation looks in our platform. So I just want to take a minute just to explain the difference, because sometimes we've seen both these words get used interchangeably. But interpretation allows a home health clinician to quickly include a medical interpreter into a video call. Okay, and that's a medically certified interpreter. On the other hand, translation is more on the messaging aspect. So ongoing messaging can also be translated into the patient's primary or preferred language. And as we were mentioning, that keeps deepening the patient's understanding and engagement. So these messages can be sent already pre-translated via text or email or in-app messaging to the patients with ongoing medication, dietary, exercise, and just general health guidance. And besides improving the quality of care, what are some of the residual benefits of this? And it's really the last portion of this slide is the referral sources. So successful home health agencies that we're seeing across our client base are able to deliver the best care, meaning care that is timely, responsive, and appropriate, not just clinically, but also linguistically as well. for each patient and their respective family home situation. And referral sources, also value the Cinzy's platform. The ability to help a home health agency better engage patients who are a part of the LEP population. And Cinzy being a HIPAA compliant virtual care platform, it allows the staff to continually communicate with all patients via those communication modalities. So on the next slide, wanted to show you all during a live video visit, and unfortunately you have two of me, so pretend I am sitting with a patient and it could be another remote staff member, but directly in the video visit you have the ability to bring in another staff member. If it's on the patient side, that little tile that's grayed out could be a family member. But right at the bottom, and I know it might be a little bit hard to read, you have the ability to bring in a live video interpreter. So by clicking that button, we'll bring a drop-down list of the available languages to bring in a video interpreter. So really very quick when you're in a video call, it's 2 clicks of a button, adding a participant, choosing interpreter, and then selecting your language. Okay, and then on the last slide of the platform, wanted to show you all just a couple examples of messaging translation. So these again are pre-configured templates that you store within our platform. They're already translated into another language besides English. And these can be saved to be sent via on demand. So if you want to just send a text message or email on demand, it's not a part of an automated program. And some of the examples that we've seen some of our clients use across the country, they could be as simple as just an appointment reminder. We've seen a lot of success on clients across the country having an appointment reminder translated into a population they're specifically serving, and they've seen the increase of their appointments just being held. A lot of our clients come on, and that's a pain point for them of missed appointments or people not being home at a specific time. And then on the extreme end, they can be some emergency preparedness or weather alerts. So depending upon where you are in the country, if you're out west, some of the wildfires in California or in the Northwest or down here in the Southeast during hurricane season, having those messages translated into a specific patient's language has been invaluable. All right, so lastly, before I just pass it back over to Parker, just a couple quick quotes on the patient feedback. I think really to sum up both of these is having those different communication modalities within the platform, you're able to really improve care of those patients' needs. They know exactly what they're reading. It's in their preferred language, and it just improves your scores and your quality of care as a home health agency in general. Thank you, Parker.
Thanks, Michael. These next few slides, we are going to have Elena go through. She has great experience as a certified interpreter herself, and she's going to share with us some of her experiences and insight.
Thank you, Parker, and hello, everybody. Thank you for joining us once again. I'm here to share my experience as a certified Spanish interpreter in this field for over 25 years. And over the years, from my perspective, I have learned that providing language access services to LEP patients is one thing, but using the service correctly is another thing entirely. Accepting the interpreter as an integral part of the care team is key to a successful relationship between the care provider and their LEP patient. The interpreter is not an outsider. The interpreter's goal is to help both parties communicate in the most efficient way possible so that the patient receives the care they need, which is the goal of every provider, whether the user of the service is a doctor, a nurse, a social worker, a therapist, etc. So using a qualified interpreter during the patient-provider interaction is going to foster patient autonomy and is really going to yield better health outcomes. If the patient clearly understands what is going on with their health or their situation, they are better able to make informed decisions, follow orders, instructions about their care, do the exercises they're being asked to do, take their medications as directed, keep their appointments, provide the information or forms they're being asked to complete. When a provider pulls in a colleague or uses a family member to interpret, it really triggers a disservice to the LEP, but even more at risk is the provider themselves. Interpreters abide by a set of core values that includes standards of practice, such as accuracy, neutrality, role boundaries, respect, and cultural awareness, among others. Trained interpreters are skilled at delivering difficult news, at remaining neutral, being accurate, dealing with environmental as well as interpersonal demands during a session. They have developed skills such as note-taking, listening and memory retention, among others. And all of these ensure both you, the care provider, and the patient have the best communication possible and that nothing gets lost or miscommunicated. I'm going to be sharing some personal stories with you today. And although they are my personal experiences with doctors and nurses, the message is the same whether you are a social worker, a home care nurse, a physical therapist. And the message is that you get the best outcomes when you use an experienced, trained, or certified medical interpreter. The first experience or anecdote I'd like to share with you is something that I will carry for the rest of my life because it was a very impactful experience that I had with a nurse and a doctor in the ICU of a children's hospital. Um, the nurse was pulled in by the doctor to tell the parents about the child's condition, but the nurse was unable to render the doctor's message correctly. The message conveyed to the parents was that the child was alive, but had a serious brain problem. When the doctor noticed the family was asking questions that did not align with the diagnosis he had just given, for example, the father was asking, when can she go home? The doctor realized that the correct message had not been conveyed. When I was called, I arrived and the doctor had to talk to the parents one more time. He subjected them to a difficult conversation 2 times. As the parents sat there and heard the interpretation and understood the prognosis, this is a part that I will never forget. I remember seeing the father sitting next to the window, and when he heard what the doctor had to say, he let out this horrible cry that I'm just never going to forget. He had previously understood that his daughter, although had some brain issues, she was alive. But now, after having the interpretation done, he was being told that she was brain dead. So he realized that his only daughter had in fact passed away, and the only thing keeping her alive was a machine. As I left the room, the RN approached me and she thanked me and said she never wanted to be put in that position again. She did not know the correct term for brain dead in Spanish, and the only thing she could think of in that moment was to say that the child had serious brain problems. So this is something that showed me the importance of using a qualified, certified, trained interpreter. It is commendable that someone would want to talk directly to their patient in their own language, and we see that often. However, in many cases, this leads to serious misunderstandings, and most often than not, the LEP will not let the provider know that they are not understanding. They will just sit there and nod their head and smile. This is often a cultural nuance for many cultures. This brings me to another story that I remember as I was preparing to share this information with you all. I arrived at a session that was already being conducted between a surgeon and the parent of a child. And he kept on using the term gallbladder in Spanish instead of appendix. He kept telling the mother of the patient that the child needed his gallbladder taken out. As I arrived to the interaction in progress, the mother turned to me and she said, I am so happy that you're here because this doctor wants to remove my son's gallbladder, but they took it out 2 years ago. Does he have two gallbladders? As I interpreted to the surgeon, he realized he had been using the wrong term and apologized to the mother. No, he does not have two gallbladders. He doesn't even have one. Everybody laughed, of course, but the surgeon turned to me and said, never again. I knew what he meant. He knew what had happened there. Care providers must also be aware of their own cultural biases and assumptions. And I include myself in that group because it's very easy to assume things or to have biases that we're not even aware of. When working with LEP patients, language is not the only barrier that poses a challenge. Sometimes our own cultural biases or assumptions can build up a wall in that communication. On one occasion, I was called to interpret for the father of a patient, and for lack of better words, he looked a certain way. He was quiet. His way of dress was very humble, and he was sitting there and just nodded his head from time to time. The provider kept directing the conversation to me, the interpreter, instead of directing his conversation to the father. So he would say things like, tell him this or tell him that. On repeated occasions, I coached the provider and reminded him that I would be his voice and that all he needed was to direct his words to the patient. When he did, this was very surprising to me. There was an obvious change in register, which took me by surprise. Before the provider could say his next words, the father, in very intelligible English, said, do you think I'm stupid and won't understand you? Needless to say, it was a very awkward situation. Another thing that can help really foster that autonomy and really build a relationship between the provider and their patients is to recognize that a linguistic barrier doesn't mean that the patient is unintelligent. Providers should really speak to their patients in the same manner they would speak to an English-speaking patient. This shows respect to that patient. LEPs have the same varied background as English speakers. Some are very well educated, while others may not be. In my personal experience, I was used as an interpreter as a child many times, and often by my aunt who had a PhD in psychology and her husband who was a dentist. They had studied in Mexico and decided to come to the United States to see if they could build a better life for themselves. Well, they didn't know any English. And so when they got here, this was like 35 years ago, they had to find jobs in whatever field they could. So they ended up working at a chicken processing plant. So this is a PhD in psychology and a dentist working at a chicken processing plant. Well, going to the doctor was a challenge for them. And me as a child was going with them to their doctor's appointments and interpreting for them. Well, they understood more about their health than I did, and I was the one who spoke English. So fast forward many years later, my aunt and my uncle both learned English. She became an elementary school teacher, and he became a dental hygienist. During these interactions, there could be other cultural nuances present as well. Understanding that speaking about the patient in front of the patient and asking the interpreter not to interpret is asking the interpreter to violate the interpreter code of ethics. It's also a cultural no-no in many cultures. It really does break the trust between the patient and the provider, as the LEP is going to wonder, what are they talking about? Are they talking about me? The LEP is going to want to know, and they're going to ask. They're going to say, what are they talking about? Tell me, what are they saying? So when you're using the service, when you're using an interpreter and you need to have a side conversation with someone, or you need to answer a call, or maybe you even need to converse with another colleague about the patient, but you don't want them to know what's being said, it's best to walk out of the room or out of the house if you're at the house and instruct the interpreter to inform the LEP that you're going to be right back. We can move on to the next slide, please. It's also important to recognize the demanding situations, such as the current pandemic, which can create stressful interactions for all parties. There's physical demands, there misunderstandings, patient errors due to lack of communication. Right now, providers, patients, we're all wearing masks, or we should be wearing masks. If the patient is in a hospital or in a facility, there might be noise from machines. If the patient, you're visiting them at home, there's going to be noise from children, TV, radios. Emotions are running really high. So the interpreter may need to request more repetitions, more clarifications than usual. And even now during this pandemic time, new COVID terms, new medications, new treatments are also going to be part of the learning process for the interpreter. So recognizing these demands is very important so that you have a better interaction with the interpreter and with your patient. Misunderstandings can also happen often. Sometimes the provider is rushing, eager to finish the house visit, because they have another visit and they're late, they're running late. Or maybe the physician has a list of patients to see for the day and they're behind. So the rushing of the provider causes sometimes for them to want to rush out of that visit, and they assume that he was understood by the patient and doesn't allow the LEP to finish their thoughts. So this can lead to a lot of misunderstandings. Patient errors due to lack of communication can also be present when the interpreter is not allowed to finish the interpretation. Asking the interpreter to summarize. We hear a lot of times when physicians or providers say, just get me the answers because you're in a rush. It's completely understandable that providers are under a tight time constraint. Everybody's rushing nowadays. We just want to be as efficient as possible and get our work done. So we understand that they want to get the information in the most quick manner possible. However, it's also true, and I speak from experience because my own mother did this and still does this. LEPs like to tell stories, and the answer that the provider needs is hidden somewhere within that story. However, not allowing the interpreter to finish the interpretation puts the interpreter in a really difficult situation and makes the interpreter the keeper of that information. Now, the interpreter can't determine what is important and what isn't important for the provider to hear within that story that they just heard. They can't make that determination. Interpreters are trained to deliver all the information heard. So if the provider does not hear the answer they're looking for, it doesn't mean that the interpreter asked the wrong question. It just means that the interpreter is ensuring that the provider hears everything that was said. And sometimes that means there's a long story being shared by the LEP. So when this happens, what a provider can do is allow the interpreter to finish interpreting that story, but then direct the patient, the LEP, to focus on the questions that are being asked and focus on giving short answers. That's going to help the LEP feel like they're being listened to, but also will get you the answers in a quicker manner that you're looking for. We can move on to the next slide. Show trust in the interpreter and the interpretation delivery methods. So technology has allowed for delivery methods to change over the years. In the beginning, the only delivery method we had was in person or on-site. Soon we moved to over the phone, and now video, which includes the amazing resource of telehealth. However, over time, some providers and LEPs have been reluctant to move along with the change of technology and use these new methods of delivery. Now, many have no choice. We have to use these methods because of the pandemic. So one of the ways that a provider can show trust in the interpretation methods that they have to use, in the language access methods that are being used, is when you call on a video or audio interpreter, don't start off by saying, "I'm sorry that we have to use the video or audio interpreter." That just creates a negative approach to using that audio or video interpreter. If needed, take a few minutes to explain the concept of telehealth. Telehealth is new to many, many people. So if the parties don't understand how it works, how can they trust the service? How will they trust the provider providing the service or the interpreter being used? Use first person. Now, talk to your patient as if the interpreter were not present. Faster, more efficient pace is achieved by doing this. Instead of saying, "Interpreter, please tell her this," or "Interpreter, please tell her that." What happens when these third person is being used is that the interpreter now has to figure out what part of that sentence to switch into first person to avoid having to say, "Interpreter, please tell her this," or "Please tell her that." Allow the interpreter to provide insight about any situation that may be impacting the session. A trained interpreter will always inform the provider about cultural nuances. A settled tone of voice of the LEP may not always be caught by the provider. Therefore, you may lose the true meaning of the message. Interpreters want to respect and support the provider-patient relationship. So if they think that the tone being used by the LEP will affect the meaning or the intent of the speaker will be misconstrued, they will let you know, or they will subtly ask you to rephrase your question. An angry or sad tone can be easily identified by the English speaker, but sarcasm many times cannot be. The interpreter can detect if the LEP is understanding or not, many times just based on the tone of voice, even if the LEP is sitting right in front of you nodding yes, that they understand. Acknowledge that technical difficulties are always possible. The interpreter is paying attention. They are focused. However, in this day and age with Wi-Fi connections that can be weak, and part of the provider, maybe the provider is using a cell phone to connect to the interpreter. There could be delayed audio, images that are frozen, or other environmental factors. All of this impacts concentration and focus, and possibly the ability of the interpreter to grasp an important utterance. So expect that they will let you know and they will be asking for clarification or repetitions. And lastly, include the interpreter. Keep them informed. If you need to answer a phone call or engage in a conversation with someone else and you don't tell the interpreter what is happening, this might cause the interpreter to continue interpreting your personal conversation because they really don't know what is happening. If the provider leaves the session and they mean to return but doesn't tell the interpreter as well as the LEP are at a loss about what's going on. They may ask, "Are we done? Is he coming back? What happened? Where did he go?" So all of these experiences that I've had in my life have really taught me to, as an interpreter, try to give the best possible service. But putting into practice these points as a provider can really help you engage your LEP patients in the best way possible, not only during these trying times of the pandemic, but always. And that using an experienced, trained, or certified interpreter will also always result in better health outcomes. The interpreter is there to help you meet your goal, which is to have the best possible interaction with your patient. So working together with the interpreter towards that goal will allow you and your LEP patient to have a really positive experience and better outcomes. Thank you.
Thank you. So just want to wrap up a couple thoughts, and I'm going to tie this slide into our next slide, and then we'll take questions. But really just want to recap a couple key thoughts, and there's really no better time to begin virtual care or telehealth, and finding a platform that allows you to communicate with your LEP population. In the time that we're in, a lot of patients feel isolated. You might not be able to manage and meet with all those patients on a consistent basis, and a virtual care platform that gives you the ability to communicate with your non-English speaking patients and general population is of huge value. So really just to recap a couple thoughts that I mentioned earlier, we never meant to replace in-person care, but really here to provide a better experience for the patient, comparable to an in-person visit or even better. That's really what we strive for. And as I mentioned earlier, not every single person communicates the same way. So, as we were just mentioning earlier, you might have the ability to bring in a live video interpreter, but some folks might just prefer a simple text or email over a video call. And you really need a platform that's going to have those messages that go out via text or email translated into their preferred language. So you really want a platform that has all those communication methods and in one place. So consolidating a lot of pieces of technology that we see our clients use into one platform, and to look for a platform that really covers that all. So all in all, being able to see more patients and provide a more quality experience is a win-win for agencies as well as your LEP patients. So thank you for everyone's time today.
Thank you, everyone, for sharing your experiences and insights regarding this very critical topic in healthcare and patient engagement. We will now answer any questions you may have regarding this topic, as well as Cinzy's and Stratus Video's integrated capabilities. As you use our Q&A tool in the webinar platform, I will just remind you that today's session was sponsored by Cinzy. Please visit cinzy.com to learn more and sign up for a custom demo of our platform. Our next Learning Lab presentation will highlight remote patient monitoring, and that will be conducted Thursday, December 10th. This concludes our Learning Lab presentation today. Thank you for your time and interest, and have a wonderful, healthy, and happy holiday season.